Indigenous communities across the country and around the world. Hear about top concerns facing Native nations. Tribal history, language, and culture is also part of Indigenous life. Check out our headline news service to learn more. Tune in here for National
100. San Juan Health Partners Urology, a division of San Juan Regional Medical Center. Ten minutes past 8 o'clock. It is Wednesday morning, March the 6th. Good morning, everyone. I'm Scott Michlin. Thank you for tuning in to KSJE 90.9 FM, the information and cultural beacon of the Four Corners, broadcasting from the campus of San Juan College. Special good morning also to our viewers who are joining us watching live on the KSJE Facebook page and YouTube channel. Welcome aboard, everybody. I'm glad you're with us. Coming up in just a moment this morning, we'll be talking about the Health Security Act, which is making its way through the Roundhouse in Santa Fe. It is a health care plan for all of the state. We'll be talking about that coming up in just a moment right here on KSJE, so stand by for that. Also later on this morning, around 8:30 or so, we'll be checking in with folks from the Connegoch Arts Foundation. They are here talking about the work that the Arts Foundation does throughout San Juan County to support artists and art organizations. So that's coming up later on this morning at about 8:30 right here on KSJE. We'll round out the 8 o'clock hour as we do every Wednesday with a trip to the Encouragement Lab. Communications professor Dr. Mike Hannabaugh is standing by this morning to talk about perception checking with me. That you will hear and see if you're watching us, of course, at 8:55. On KSJE. Roving with the Arts follows after the news at 9 o'clock, and that is coming your way today with Arts News. Mick Hess will be here with that. And then don't forget about Right on Four Corners. It's our local and regional author program today. Host Tracy Hales-Vass is speaking with author Jean Burroughs Johnson about her series of books and her characters, talking about them this morning at 10:30 right here on KSJE. So we hope you'll check that out as well. You can always go to our regional events calendar, too, to find out what's going on throughout the area. That's at KSJE.com, and we'll show you a few of the events that are coming up, but remind you that later on this week, don't forget, of course, it is the San Juan College Spring Musical Oliver at the San Juan College Little Theater coming up this week. Also, March 14th, the San Juan College Pi Day Mathematics Festival is happening. Also, there's an Astro Friday program at the Planetarium on March 15th as well. Just some of the many events you'll see when you check out our regional events calendar at KSJE.com. Well, let me turn to my guest who is joining us from Albuquerque via Skype this morning, and that is Donna Dowell is here. She is the media director for the Health Security Campaign. And Donna, thank you for joining me.
You're welcome, Scott. Good morning.
Nice to have you with us, and talk to me a little bit about this bill that we are talking about. This is a bill that would strive to get more healthcare access and coverage to more New Mexicans. Is that the idea?
You're right. Yeah, the purpose of the 2019 Health Security Act is to study a specific statewide, well thought out, long in the coming act plan that would ensure health care coverage for all New Mexicans. It would enable New Mexico to set up its own health care insurance cooperative. And the plan provides for freedom of choice of doctors and other providers, along with comprehensive benefits.
And I know you have been working on this for a number of years, this idea. And so the bill that is being discussed in Santa Fe is basically, as you mentioned, to fund a study to see how this would work in our state and how this could help New Mexicans. What are the costs involved? How could we shift from what we have now to what this is proposing? And the study is what's being called for in legislation this year at Santa Fe. Is that correct?
That's right, but the bill accompanies the act for a study, because you have to know what to study. You have to know who, how much, where, what, how it's going to all work out. So the details are in the bill itself. And then in 2021, there's an automatic repeal. So the whole thing is repealed, and legislators with that fiscal study in hand have the opportunity to vote it in or not. But they'll have the information that number crunching in front of them to say whether or not we can go ahead with it. It's a cautious, multi-year plan toward implementation.
Understood. And with your work on this, and so whenever we talk about healthcare, I know folks get a little nervous because it's such a complicated animal and there's so many moving parts, and a lot of folks maybe that have employer-paid healthcare plans don't maybe want to see any changes, but others who don't have access to healthcare could certainly benefit from something that we're discussing. And so what's your message to folks who are watching and listening to us this morning about talking about an encompassing change to the healthcare system in New Mexico?
Well, the act really gets at major cost reduction, cost savings, and increased access. So first of all, it would provide comprehensive care equal to or greater than what state employees currently get. All of the current money coming into the state, the federal dollars, like Medicare and Medicaid, ACA tax subsidies, would remain. And so the rest of the risk pool, New Mexicans,
right,
would be made up of employer and employee contributions with caps to those. So some groups will be exempt, like military, they're already covered, and federal employees. But like large insurers that are compliant with ERISA, that's a federal standard of offering, minimal standard of offering health care to your employees. Those ERISA compliant large employers like Intel and Los Alamos would opt in, would have the opportunity to opt in. As well, tribes as sovereign nations would also have the opportunity to opt in. And we're thinking that the analysis show that it would be very advantageous for these groups to opt in because we would have such a much larger risk pool, 1.7 million people in the risk pool. So that would reduce costs and reduce risk.
And that is
it improves access. Go ahead.
I was just going to say, that is something I know that you've talked to me about before we came on the air, about reducing costs, and a lot of folks do have some really concerns about the increasing costs of healthcare in the United States, for one thing, in New Mexico for another. But you're saying it would increase access to some of these groups that you're talking about.
There are no networks, so that in itself will remove barriers to healthcare. So any patient in the state can see any provider can see all patients. The plan would relegate current large insurance providers to a secondary or supplementary role. So they could, much like they do with Medicare now, they could sell insurance to cover co-pays and travel and such, but the primary payer would be the health security plan, and it would be one payer. So that reduces administrative costs tremendously. It's estimated that administrative costs are 20 to 30% of our healthcare costs, and that would go down to 5 or below. There have been two other studies, one in 1994 and one in 2007, that studied this plan as compared to the current health insurance market system and as compared to the exchange. And of course, 94 and 2007 were before the ACA even came into being. So even without those subsidies, it showed drastically reduced administrative costs, with the savings in the hundreds of millions and if not a couple billion over just the first few years that this plan would be in implementation.
I see.
So there are huge cost savings. Right.
ACA, of course, the Affordable Care Act, and a lot of folks get nervous when we talk about the Affordable Care Act because some of them see that maybe their health care expenses have increased under the ACA, while others certainly have gone down, and the ACA has made health care available to more New Mexicans, I think, in some of the more rural areas of the state, that's for sure. And so with this plan, and you're right on my next question, which is what will happen to the insurance companies, and as you said, they go into maybe a secondary role, and is that how maybe employers could maybe sweeten the pot a little bit with some other extra benefits for their employees if we're all covered under the same plan? An employer could offer maybe a supplemental insurance plan to help with co-pays or other benefits. Is that how you see this happening?
Well, the employer could pay for all or part of the employee's premium.
Right, I see.
The employee premium would be based on income and income alone. It would not be based on age or health status or employment status. So the idea is that everybody pays something. So that employer could, for instance, pay the entire premium. Employer premium contributions are also capped. Those don't. There's a ceiling on that too. So that would employer premium would be somehow formulated with number of employees and payroll with a cap. But you don't want to disincentivize employers from giving employees raises because they may have to pay more in their health insurance. I mean, putting everybody into one large risk pool reduces costs tremendously. The way we have it now, the way we segment our population into different pools, such as 65 and older, well, that care is very expensive. And so here's another issue for providers. That care is so expensive that Medicare, often you hear this complaint from providers, they don't reimburse enough because that care is so expensive. Now, if you put young, old, or mature, I should say, because
right.
I'm one of them.
I'm getting there. I'm right there with you.
Healthy and not so healthy people all in one risk pool, you reduce those costs and we can increase the reimbursements to providers. So that's, just stabilizing costs is a huge issue. Healthcare costs will continue to rise, but it's how fast they're going to rise. In these two previous studies, it showed that this plan reduces that increase in healthcare costs, which we really need to get under control. Right now, we have very high costs and very low access. Not everybody is covered. We have 200,000 people in New Mexico that are not covered with health insurance.
Right, and this would change that. This would fix that problem, you're saying. Everybody would be covered, right? Mm-hmm. Mm-hmm. And so talk to me a little bit about the reactions that you're getting from Santa Fe. This legislation is still working its way through the Roundhouse. There's been some hearings. It's been in some committees, correct? But it's still alive, as they say, making its way through. And where does it stand this morning?
It is still alive. We have some committees yet to go. We have the appropriations in the House, and we have judiciary in the Senate. And as you know, time is running low. We have some really strong sponsors, Debbie Armstrong and Bobby Gonzalez on the House side, and Jerry Ortiz-Pino and Carlos Cisneros, among others, on the Senate. Mm-hmm. The plan, and again, it's only for the fiscal analysis, sort of a fail-safe for legislators to vote on this because there's no implementation. We're just actually asking for the study. We need that information. We need to know, and through the study, we'll find out how much we're spending currently on healthcare in New Mexico, and we don't really have those numbers. And before we implement any kind of healthcare reform, we've got to get that kind of data organized around a specific plan. Right. Anyway, so this. And the big concerns are with the insurance companies, of course. I think they're worried that they cannot beat the largest coalition in the history of the state. We have 173 organizations who have endorsed us, and 36 municipalities and counties who have endorsed us. We just most recently got the Valencia County commission, 3 Republicans and 1 Democrat to pass a resolution. We've got a bipartisan resolution from Roswell and Los Alamos. We've got a couple of Chamber of Commerce who have endorsed us. So this is really a bipartisan friendly reform.
Right.
It's not tax-based. There's no new taxes. There's no, it's tax revenue neutral, rather.
Right.
And so, we do have legislators from both sides of the aisle that are looking at this and seriously considering it.
And again, to be clear, this is, as you said, it's just this legislation this year is just asking for this study, but there is a dollar amount associated with that, correct? How much money are you asking for to fund this study to see kind of what it would mean to New Mexico if a healthcare reform bill were to be passed at a future legislative session?
We're asking for $375,000, and we believe that the fiscal analysis, which would be run or oversight, would be provided by the Legislative Finance Committee. This is a dual-chamber bipartisan committee that would be in charge of the fiscal analysis. We believe we have the talent here in the state to do that analysis from UNM and New Mexico State, and it has been done before, so this is not new territory. We have those two other studies that were done in state, independent, and what had good results. One of the most exciting things to me as a provider, I'm also a family nurse practitioner, about this legislation is that this will really seed a comeback in private practice, so that physicians and other healthcare providers, myself included, would be able to hang a shingle and open our doors to patients and bill a very simplified billing and reimbursement process. We wouldn't have to hire 10 people to try and figure out all the different plans we currently have through insurance carriers, and the deductibles and the co-pays and the prior authorizations, all different for each one of those plans. That's where all that 20 to 30% administrative costs come from.
That would go away.
People say, well, you're reducing competition in terms of the health insurance industry. Well, but we're increasing competition in terms of the provider, the service provider. So we want to see a major shift, a paradigm shift, away from insurance choice and increasing drastically the choice we have as patients for our providers. People don't really care about the payer. They don't really care. They're not really attached to their insurance companies, but they are attached to their providers. And especially in rural areas, people want to see provider reimbursements go up. They want to see stability in their community hospitals. This will provide that. They want to see a more choice of provider. They want to see more primary care and specialty providers in those rural areas. And most of our state is rural. So this is really, the bill is very much geared toward rural areas. It's not state-run. It's run by a commission. Think of it as a co-op.
Right.
And so on that commission, 9 out of 15 seats would be outside of the urban areas of Albuquerque and Santa Fe, and would geographically represent the entire state.
That's part of this bill as well, is how that would be set up, correct?
What's that?
That's part of this bill as well, is how this commission would be set up, is how it would be, if it would to be implemented. It kind of talks about that.
Yes, it's very specific. Who is on this commission? What is the oversight? The commission is transparent. There's public input. There will be committees that advise this commission, like primary care committees and tribal health committees. So the commission will be well informed and open, transparent. Their accounts, the way they utilize healthcare resources, will be a transparent, known public participation kind of process.
Understood. Donna Dowell is my guest this morning. She is the media director for the Health Security Campaign, a bill that's currently making its way through the legislature in Santa Fe to ask for a study to fund some health care reform in New Mexico. And Donna, we just have a couple of minutes remaining. Do you have you heard anything from the governor's office? Is she supporting this this effort? Do you know if it gets to her desk?
We do have the governor's support. She's said so publicly on more than one occasion. So we're not expecting any obstacles there, which is wonderful.
If it gets there, when it gets there, right?
Yeah. And thank you for that positive vibe.
For folks who are watching and listening to us this morning, if they want more information, because I know that, again, as I mentioned, this is such a complicated issue, and a lot of folks feel very strongly about health insurance and what may be being proposed. I know you have a website which probably has a lot more details than what I've been able to get into with you this morning. If folks wanted to go find out more details about what we're talking about, they can do that online?
Yes, it's just nmhealthsecurity.org. And the website is wonderful. It has the full bill on there, so you can, or fact sheets like, why is this bill good for seniors? Why is it good for businesses? Why is it good for providers? New Mexicans want comprehensive coverage and choice of provider at a reasonable price. We don't have those basics in our healthcare system right now.
And this would provide for it?
Yes.
You think? All right.
Most definitely.
And again, but what we're talking about at the Roundhouse today is just the study to just see how much this would maybe cost, or how easy it would be to implement, or what it would mean to folks living in all parts of our state. This is what we're talking about this year.
There are lots of details that need to be worked out, and one of them is the cost, the number crunching. But this plan is actually simpler than what we're currently embroiled in now. Nobody really can figure out what the health insurance and health provider industry is doing for it. What value does health insurance, the way it's set up now, really add to our healthcare system?
All right. Donna, thank you for joining me this morning. I appreciate your time and your insights into this complicated issue. Thanks so much.
You're so welcome, and thank you, Scott, for all you do for your listening audience, and especially exposing them to this important legislation.
Thank you very much. We'll see how it goes, and we'll touch base with you again as the legislature comes to a vote and wraps up in the next week or so. So thank you again.
Thank you, and have a good day.
You are welcome. You're very welcome. That is Donna Dowell. She is the media director for the Health Security Campaign, and we were talking a little bit about healthcare reform, bill that is making its way through the legislature in Santa Fe. I'm Scott Michlin. I'll be back with more in just a moment here on KSJE. The time is 8:31. This program on KSJE is supported by Citizens Trust and Investment Corporation, providing a competent, innovative, and caring team of professionals to serve wealth management, trust administration, employee benefit plans, retirement planning, and estate settlement needs. Find out more about Citizens Trust and Investment Corporation at 505-599-0181.